Hello, I'm Chandrika Balachandar and one of the trustees for Mothers for Mothers. During this Mental Health Awareness Week, on behalf of Mothers for Mothers, I would like to share my thoughts about the importance of supporting mothers with mental health problems. 1 in 5 women experience mental health issues, ranging from anxiety and depression to more severe illness. These can be present during pregnancy and up to 1 year after childbirth. For most women, pregnancy and childbirth is a route towards joyful parenthood. This expectation of joy and excitement is not just for the mother, but for the whole family. Mental health issues can get exacerbated if the mother is known to have an underlying mental health condition. Unfortunately, the social expectation of joy results in about 70% of the women either hiding or underplaying the severity of their mental health. Mental health is the leading cause of maternal deaths in the UK and is on par with deaths due to physical causes. Many of the women who died from suicide or substance misuse faced multiple adversity. It's widely known that physical illness such as high blood pressure can affect pregnancy and vice versa. Similarly, mental health can affect and be affected by pregnancy. In March of this year, the Center for Mental Health released a report about the economic and social cost of mental health. The report estimates that the annual cost of mental ill health to people, businesses, and public sector is staggeringly high and is twice as big as NHS England's annual budget. The report recognizes that the full impact of the problem cannot be expressed with the pound sign. However, the cost highlights the significance of mental ill health as an issue deserving of health service investment and reform. Higher investment in cost effective health and care interventions, such as community services, early intervention, and early prevention, are likely to reduce economic and human costs. This makes the service provided by Mothers for Mothers to be highly valuable and credible in this regard. All women deserve and have a right for equitable access to compassionate mental health care. All women must receive mental health care irrespective of ethnicity, physical ability, sexual orientation, or drug and alcohol addiction. Barriers do exist for these women experiencing mental ill health, and barriers prevent them from accessing healthcare. Cultural stigma, deprivation, and discrimination are some of the barriers which prevent women from accessing healthcare. Sadly, more than 50% of the perinatal anxiety and depression go undiagnosed despite contact with professionals. Women quite often downplay their mental health conditions. This can be due to fear of being judged or due to fear of having their baby removed from their care. Another example of the barrier is that domestic abuse is quite often seen as a social issue. Mental health, ill health caused by domestic abuse is often overlooked. Thus, this becomes a service barrier. Inclusive care refers to care delivered in respective of particular needs of marginalized or vulnerable women. It should be delivered in such a way for them to overcome their particular barriers and seek help and support. Access to mental health and support before, during, and after pregnancy is an essential aspect of healthcare. Progress has to be made. By supporting women to talk about their traumas and difficulties in a safe place without any judgment, Mothers for Mothers is able to provide a compassionate and caring service. With a community presence and appropriate referral systems in place, Mothers for Mothers is an excellent example of a service model. that is always striving to make ongoing progress. I am indeed privileged to be serving as a trustee for this charity. Thank you very much for your attention.